Hey, everybody, this is Tom Sega from Duluth Pack, and this is the Duluth Pack podcast, Leader of the Pack. Our special guest today is a true leader. It is Dr. Perry Regas, MD, anesthesiologist at Essentia Health in Duluth, Minnesota. Welcome, Dr. Regas.
Thanks, Tom. It's great to be here.
Well, we are super excited because, the layman like myself and everyone else out there, to learn a little bit more about what goes into the lives of doctors. I think we just, especially with what we all just went through the last few years, we just find it really intriguing to learn about you and learn about your life. So, Dr. Regas, let's just jump in and learn a little bit tell us about your childhood and growing up, and where did you grow up?
Well, actually, I was born in Duluth, Minnesota, 1976, which it's great to be back in Duluth and practicing medicine. I was just kind of thinking about it before this podcast, and I remember when I first came back to Duluth to practice here, one of my first cases was with the surgeon that delivered me. So I felt it was very
Out of
special.
here.
He looked at me and he said, "Oh, are you a new doc here?" I said, "Yeah, I'm Perry Regas, one of the new anesthesiologists." And I said to him, "You delivered me."
Did you make him feel really old?
I did, but he was such a great man, Dr. Holt. Yeah, he's such a great man. It was great to see him, and um, my family has always regarded physicians and the physicians that they've had here in Duluth in such high regard, and I'd hear about them a lot growing up, especially my dad. He would talk about all his doctors and everybody he's had and what they did to him, and he just had great respect for the physicians of Duluth. So it was great. I think he instilled that in me too, and oftentimes I should say, I feel a little unworthy to be in the practice because I still respect a lot of these physicians that I'm around, because to see these people, these great physicians do such great things is it's really awesome. But yeah, I was born in Duluth. I traveled the school system from Chester Park, which is no longer there, to Woodland, which is no longer there, to Duluth East, which has been converted. So it's nice to be back home and to see the old buildings, at least, except for Woodland, of course. But had a great childhood. I grew up in the Chester Park area, just a couple blocks up from Terrence Market, and right on the border we were on 19th Avenue. So once it came down to the high school, we were right on the border. So half my friends went to Central, half of us went to East, but we still congregated in the back alleys of Chester Park and played street hockey. So it was a great neighborhood to be a kid. It really, real fun.
The good old days when you could go out in the street and mess around.
Absolutely. Then you'd hear the mom or dad scream, dinner time, and we'd all just kind of disperse to our homes, and that was that. So,
holy cow! So, right here in Duluth, Minnesota, and so many of our listeners are all over the world listening on this, and Duluth Pack's right in Duluth, so it's great to talk to somebody that's local right here, and what it's like growing up in the great city that you work in and that we actually have our business in as well.
Yeah.
So let's talk. So you graduated high school. At that point in high school, did you have aspirations to be a physician? And then when you went to college, where did you go and what did you major in?
Well, I did have medical aspirations, and growing up, my family, both my parents were born in Greece, and they immigrated to the United States. My dad in the 1960s and my mom 1970s. And they ran a restaurant in Duluth called the Deluxe Coney Island, kind of specialized in Coney dogs and gyros. And so as a son of a Greek immigrant, the options were very limited as to professions. Either you take over the restaurant, you become a doctor, a lawyer, or a priest. So that's kind of what the breakdown was. those were the aspirations for the immigrant parents, was that, we're going to aim high. This is what you're going to do. These are honorable professions. This is something that you should do. And so it's always, taking over the restaurant, being part of the restaurant world was always kind of the option, the go-to. But as a young age, and if I can step back a little bit, when I was a young kid, I knew my dad sold hot dogs, Coney dogs. I know he owned the Deluxe Coney Island, and he was a restaurateur. But I also thought he was a doctor. And the reason I thought he was a doctor was because across the street from his restaurant in Duluth, Minnesota, was a publishing company called Harcourt Brace Jovanovich. And they published a magazine called Physicians Management. And he would model. He was a handsome guy, and he was a very outgoing guy, so he would sometimes model for him. So scattered around my house were these covers of these magazines with him in a white coat. I'll show you a quick picture without. There he is. I know your readers can't see it, but there's my dad in a white coat with a stethoscope around his neck, arm wrestling a guy, talking about income issues with physician practices. So I was like, I want to own a restaurant, and I want to be a doctor. And I just kind of gravitated more towards the medical field because, I don't know, just something inside me that thought, I think this is something that I'd like to do. But I went into college with an open mind, and I graduated from East High School, and I went to college at St. John's University in Collegeville, Minnesota, and still kept an open mind, but at the forefront was the hopes and aspirations to go to medical school someday.
So your major and minor there would have been?
Yep, I majored in biology, and I really didn't have a minor at that point. Kind of like all the other courses were kind of like a pre-med type minor, chemistry and the other theology and other things that we had to take when we were at St. John's. And then when it kind of got down to my last couple of years, I said, well, this is something that if I don't pursue it, if I don't go for it, I think I might regret it. So I said, I'm going to give it my all and give it a shot, and hopefully get into medical school and pursue what I think deep down inside me I knew was what I wanted to do. So.
Oh, that's awesome. And you know what? I gotta stray aside here for a minute, because anybody who is ever coming of our listeners to the Duluth area in the summer, I have to throw a bone out for your family business, the original Deluxe Coney Island. Yeah. Oh my gosh. We literally will go down there, my family, and we'll get them 25 at a time and bring them home and freeze them, because you could go and look at all the recipes online you want, folks. And I'm sorry, you can't touch it. It just doesn't do it justice. So
it's so great.
It's unbelievable.
Tom, it's the greatest thing that ever happened to me in my life was working there and working with my parents. I tell people often, they say, why'd you go to medical school? I said, because owning a restaurant would have been just too hard. I mean, every day, my dad would wake up at 6:30, 7 o'clock to be there. He was the first one there, the last one to leave every day when I was growing up. And I worked there. I started working there when I was 12 years old. And just to be there and to be around him and just the life lessons that he instilled in me was the best. And I remember another story when I started my career, and some people that were Duluthians, some physicians, and one physician in particular, he's like, my mom, she loves the Coney Island. I said, I know. 2 Coneys, no onions, large Diet Coke, and an order of fries. He's like, are you serious? I'm like, oh yeah. Oh. There's nothing better than just the regulars and the love that they have. It was so satisfying, because when you got something that people love and they want to come and get it, just like your company, it feels good. And it feels good to have them come there And it was just great. I mean, just to have that work ethic and to see my parents, and I've been to the village where they grew up in Greece, and there is not much. I mean, we're talking about my dad had two older brothers, and by the time when he was 8 years old, by the time he was 8 years old, they lived in a one-bedroom house. And just to see what he's done, see what they've done to come here, and just it's amazing, to have to be able to educate kids. And that was my parents' big thing: educate, educate, educate. I want you guys. I don't care what you do, but you got to get an education. We want you to stay in school. You got to get the education. So it was great life lessons that I'll never forget.
Work ethic, and obviously let's jump into in a second here the University of Minnesota Medical School, because obviously a lot of hard work and the life lessons you learned at a younger age of hard work and watching your parents work hard every day had to obviously pay off when you went to medical school.
Yeah, it did. I mean, it was, the biggest hurdle to pass is getting into medical school, as many people say, and that's it's a big challenge. There's many tests that are involved that you got to take, and you got to get the good grades. And I remember once you make those marks, and then you apply to medical schools and you do the interviews. I mean, there's this long process, this long time frame where you're just waiting for that golden ticket to come in the mail. I was sweating bullets. I remember I would chase the mailman down. I mean, that's how I mean, your whole future is like on this letter that says, welcome, you've been accepted I started off in Duluth. So you've been accepted to University of Duluth Medical School. And the mailman, I'd be like, you got anything? He's like, oh, not today, Perry.
Well, you know what? There you are, and in between, you were probably down making coney dogs.
You know what? And that's where I found out I got into medical school. It was a Friday night. I was working. I was done with college. I was working at the Coney, and Lillian Repish, she was the student affairs director at that time. A wonderful, wonderful lady. She called me up at the Coney. She knew my family. She knew our story. She called me up and she said, Perry, she said, call your mom and dad because you're going to med school. I mean, how much it meant, and no better place to be than where it all started for us. So it was a great feeling.
Wow, I can just see in your face, and folks, you can't see this, but I'm looking in Dr. Regas's face when he's talking about that, and I can just see him reminiscing just by the look on your face when you were talking about that, and the smile on your face when you were talking about that is so cool. So how many years did you go in Duluth? All 4 years of med school?
We do your first 2 years. So medical school, your first 2 years are primarily didactic. That's where you're doing a lot of the classroom education, the pathophysiology, the science-based anatomy. And then your last 2 years of medical school is where you get the exposure to the different practices. Like you rotate through internal medicine, pediatrics, surgery, and that's kind of the opportunity for a lot of people to see maybe where their interest lies. I mean, when I entered medical school, I was, as I'm an anesthesiologist, it's the last thing on my radar that I would be doing when I entered medical school. I thought I would probably be doing primary care, family practice, pediatrics. But in those last 2 years where you start doing your clinicals, you get exposure to, there's so many different areas of medicine and so many different practice styles that as I rotated through them, I thought, I think I like the more kind of critical care, the more, critically sick, acute medicine. So I did a rotation in anesthesia at the University of Minnesota, and just to kind of see that more kind of critical aspect, do some procedures, and I just fell in love with it. There's an intimacy involved in anesthesia, and kind of humility, humbleness in anesthesia, where no one really understands what we do. We're kind of like the Oz sometimes behind the curtain, just making people fall asleep and waking up. And that's kind of that was my interpretation too. I'm like, I just put people asleep and you wake them up. And as I rotated through it, I realized, I mean, to me, it was just, I felt like I was watching the Discovery, like when I was a kid watching the Discovery Channel, when they had those medical shows and they would used to show people having surgeries and things like that. It's like, I'm seeing these people have very significant surgeries and they're completely still, completely normal, heart rate, blood pressure, everything is completely normal. And then they wake up and they're like, it's done. That's it. And it was just such a great feeling. But I also, going back to like that intimacy of it, I mean, your surgeon, your doctors, you've talked to them, you've met with them, you know what's going on. All of a sudden, this guy comes in, this woman, and says, I'm your anesthesiologist. I'm going to knock you out. I'm going to keep you unconscious for maybe hours, whatever. You trust me? I mean, you have a short period of time after they've known all these other people for me to garner a relationship with this person and let them know that you will be safe, you will be asleep, I will take care of you while you're having surgery, along with my team. We will take care of you. You will be safe. And it's like better than any medicine is being able to instill that feeling of that reassurance that, okay, this is it, this is it, this is going to be okay. And I gravitated toward that. And there's kind of a completeness in the practice of anesthesia, which I gravitated to. It's like you can see your work through completion at the beginning where you anesthetize the patient and they fall asleep to the end where they wake up and you get to see the recovery phase too. And I like that completeness.
Let's take a step back, and I have a whole bunch of questions about that of building that trust and all that. But before we get there, let's talk about, you graduate medical school at the University of Minnesota, and then you go on to Dartmouth Hitchcock Memorial Hospital in New Hampshire. Tell us all about that experience and your residency. At this point, are you pointed in the direction of anesthesia?
Yep. So at the end of medical school, you decide what you want to do. Most medical students will do an extra rotation in the field that they've chosen. I did anesthesia. I did my rotation where I thought, okay, I want to be an anesthesiologist. So I did an extra rotation. And then you find programs throughout the nation that specify in certain hospitals have certain what's called residency programs that train medical students at that point. Once we graduate medical school, we're doctors. They train doctors to that certain specialty, like family practice, internal medicine, pediatrics. You find a residency, you apply to those residencies, and then after you apply to those residencies, it goes through something called a match, which is kind of a complicated system, but it's like you rank all the places that you like, they rank you, goes into a computer, and then all the medical students from the University of Minnesota go to a banquet hall, and they call your name and they hand you an envelope. They hand you an envelope and you open it up and it tells you where you're going to be, for me, for the next 4 years. It's because anesthesia residency is 4 years. So it's like, okay, I'm going. And obviously you want to pick what you want high and hope to get what you want, high. And if you don't want to go there, you probably shouldn't put it on the list, but some of them can be pretty competitive, like anesthesia. So sometimes it's better to rank a few more, but I kind of, I don't want to, I can go on, but I interviewed at Dartmouth, and it was kind of a long shot because it's far away and my whole family's in Duluth. So I thought, okay, I'm going to go to the University of Minnesota or Mayo or somewhere close by. But a couple friends who were also going for anesthesia said, you should look at this program. It's a great program. So I went there and I interviewed, and they gave me an interview. So you request an interview and they granted me an interview. So I went out to New Hampshire. I'd never been out on the East Coast before. And I was there on the interview day, and I was sitting waiting to be interviewed, and there was another student across from me, another medical student across from me. She said, "Where are you from?" I said, "Minnesota." She said, "You're not getting in." I said, "Okay, all right." She says, "I went to Dartmouth College. There's 6 spots. 4 of them are for Dartmouth medical students. I know at least 6 that are going to possibly get it. You're not getting in." So I'm like, "All right, fine. At least I got a trip to New Hampshire." So, which actually I felt like it was a little bit of a blessing because, it just kind of knocked things down a few notches. Anxiety when I'm like, all right, well, whatever. But the day before my interview, I went to the Dartmouth College campus is beautiful. They have a museum there. I walk into the museum, and right as you walk in, it's a very open area, is this bust of this Greek man, and the lights are shining down on him. And I know who this is. This is Pericles. My real name is Pericles. I walk up, I'm like, it was on exhibit. It was from Greece, is a bust of Pericles right in the middle of this. So I went in my interview, and I didn't know who this guy was, but he was the chair of the department, the head honcho. He says, "Why do you think you should come here?" I said, "I think it's obvious. You guys have a bust of Pericles in your museum here." I said, "It's destiny." And later on, I did get in. Later on, he said, "That was something. That was something." And it really stuck with me, along with everything else. But so anyways, to go back, anesthesia residency is 4 years. The first year of the residency is what's called the intern year. So essentially I do everything essentially but anesthesia. So I do surgery, internal medicine, critical care, all the specialties of medicine. Because in anesthesia, you have to be well versed of all the fields of medicine. Because essentially, the way I think of anesthesia is I'm an extension of the patient's physician, your primary care physician. So when I go and take care of a patient, I look at their medical history so that I know what they have, I know what they need, and what they may encounter physically as they go through surgery. So it's almost like your primary care physician is handing off the baton to me while you're having surgery to take care of you while you're having surgery, which is, it's a big impact on the body. So that first year is being well versed at the different practices of medicine. Like I said, pediatrics, internal medicine, critical care, even palliative care, because we deal with a lot of pain issues and chronic pain and medicines that help alleviate pain. So and then the last 3 years are specifically anesthesia. We're in the operating room all the time doing anesthesia and learning the art and science of anesthesia.
Is it true that while you are a resident, you certainly get all the nights, all the weekends, and all the holidays?
Absolutely. You mean off?
No, not off, that you are working.
Oh, yes. Almost definitely. Almost definitely. Yeah. I think of, like, especially that first year, it's every third night we're there. So like Monday I'm there for 24 hours. Tuesday I'm there in the morning. Wednesday I go back to work, and then Thursday I'm there for another 24 hours. And I just remember sometimes I wake up, and then from like when I I had an apartment, there's like a trail of bags and clothes and everything leading up into my bedroom. Like it's just like a whole trail. It's like you walk in the door and you just take everything off and you just go and you just lay down and fall asleep and then wake up and then do it again the next day. That's amazing, Tom. It seems so far. It's the things that we experience, but it's great. It's a privilege. It's an honor and a privilege to be able to do it and go through it. That's for sure.
Thank goodness that we're younger when we do it. We have all that energy, right?
I know. That's so true.
I always say God plays that funny trick on us, Perry, that he gives us all this energy and when we're young, when we don't have all the experience, and as we get older, we don't have the energy, but we have the experience, and it just seems to balance out real good in life.
Oh, absolutely.
So, Perry, let's talk about certifications, licensure. You're licensed in both Minnesota and Wisconsin. What goes into getting licensed as a anesthesiologist? And then a follow-up to that would be, how about recertifications? And do you have to take continuing education and classes and courses?
Yep. So the first process is you go through the residency and you complete your residency, and then you have two main exams. One is a written and one is an oral exam at the end of residency. So those are like the final hurdles. It's like, okay, you spend 4 years training to be an anesthesiologist, and then you've got to pass the written, first pass the written, and then you've got the oral, which is absolutely frightening. They pick a location. Now I'm sure it's different, but they pick a location, and I had already started my practice. So my first job out of residency was at Abbott Northwest in Minneapolis. But I wanted to work in Duluth. Actually, I should go back because I know you asked me some questions about certification, so I'll go back to those. But the licensure is pretty much once you decide like where out of residency. Most of the hospitals will help you with getting licensed through the state of that you're practicing in. So essentially, they look at all your credentials, and it's always contingent on when you're a new graduate of residency, completing those final two tasks. So you get kind of a contingency license that you pass your written and your oral boards. And so, and essentially then after that, like I have a license in Wisconsin. That's because Essentia has a hospital in Wisconsin, in Superior. So they go through the credentialing department at Essentia goes through that process for me. But it's a submission of all my, it looks at, is there any red marks in his chart? Are there, how many hours has he spent doing these things? And then they submit the license, and then I get a state licensure. And then after that in anesthesia, every 10 years, you have to recertify. But within those 10 years, there are numerous things that you have to accomplish. One of them is called continuing medical education. So you have to have so many hours of continuing medical education. And then you have to do like a test. Every year you have a certain amount of questions that you have to do quarterly. Like now it's all computerized, but it's basically test questions that they also keep that you have to do throughout the 10 years. And then you have to have you can either do a simulation course the first 5 years, or you can do other kind of projects. So there's a lot of things that they continually do to make sure that you're at the top of your game, and that you're just not like, all right, that's it, I'm done. I don't need to know anything else. What I learned. So it's a pretty extensive process, and it serves a great purpose. And it's something that I'm kind of glad that we have to do it, because it just kind of keeps things fresh as much as possible.
So a lot of work goes into it, other than just your day work, to continue to educate yourself, come up on technology and new things that come up.
Yeah.
So let's jump in. We went through this thing the last couple of years called COVID.
Yeah.
And everyone's lives, obviously, out there were turned upside down, but probably no more than healthcare workers. So what were some of the biggest challenges you had during COVID as an anesthesiologist, when the hospitals were full of COVID patients? We did hear a lot of, just you could read the news and it was saying, if somebody had a knee that needed to be operated on, well, you may be waiting a while to get your knee done just because our hospitals are full of COVID patients. What kind of challenges did you have in your practice?
Well, it was a scary time, that I remember that March when everything shut down, no elective cases, but we still kept our main hospital open. So we still had people that were, besides just the COVID patients that needed major surgeries, that were coming in with acute surgical needs. And so we were there, but, it was scary for a lot of people, but someone needed to take care of these patients. And how did we go about it, especially at the beginning? I mean, I felt like I was an astronaut walking into an operating room to one of the main things that we do to anesthetize a patient is place a breathing tube, and that's how anesthesia is administered. And so we're dealing with an airway that is supposed to be the source of this particulate matter that can spread COVID. So we'd walk into these cases with, especially, it felt like an astronaut trying to deal with this patient that you just wanted to reassure that everything is okay, but when you're covered, it's hard to do that. So it was definitely a very scary time, especially at the beginning of the unknown. And I remember I would come home, I would declothe out in the garage, because I got 2 little kids. I'd walk into the shower, I would take a long shower, I would, scrub myself down, and then I would come back and be with my family. But I kept my COVID clothes in the garage, hoping that that's going to create this barrier and keep it away from my family. But it was definitely a hard time, especially not to be able to have that connection, that close connection that we did before with a patient, because, you had to be so guarded. And especially when you didn't know who had it, and the testing wasn't quite there. So those first few months were really, really hard.
Oh, that had to be so challenging because there was so many unknowns, not only for, us, the patient that would be coming and seeing you, but for you, the physicians, because everyone was learning more every day about this crazy thing out there. Yeah.
We did it. Our team, the nurses, the surgeons, we did it. This is what we're here for.
We have discovered the best American-made truck racks on the market. The Minnesota-made truck racks by Spring Creek Manufacturing are built with aluminum and are universal, meaning they can fit most brands, styles, years, and bodies of trucks. Plus, they are rust-proof. Whether for your truck or your company's commercial fleet, these are the truck racks for you. No need to buy a new truck rack every 3 to 5 years. Buy it once and have it for life. Plus, enjoy an exclusive 15% off, yes, 15% off your next online order with springcreek.com with code LEADER15. That is LEADER, LEADER 15. Exclusions apply. Now, back to the podcast. Now we're post that whole time frame. And Perry, what would a typical day look like for you?
So I would be assigned to a typical day. I usually get to work around 6:30, 6:45. I have my caseload. I'm assigned to usually three operating rooms, and I look at the different types of surgeries that they're having. And then as the patients come in, because they're scheduled throughout the day. So I see my first patients through the day. I look at their charts, get a good understanding of their health risks and their needs for surgery. And then I meet with them, create an anesthesia plan. And then once it's time for surgery, we go into the operating room, we anesthetize them. And then I have a nurse anesthetist stays in the room with the patient at all times. And then I circulate between the 3 rooms and see my other patients and create the plan. And then kind of goes throughout the day, taking care of different patients and their different surgeries.
You could be doing somebody with a knee in one room, knee replacement, let's say, somebody having a heart surgery in another room, and somebody having a gallbladder taken out in another room, all at the same time.
Yep, absolutely.
Wow.
Yeah, it's great. It's great to be a part of it. That's for sure. One of my areas of I specialize in is orthopedics and nerve blocks. So it's kind of one thing that I tend to do a lot more of. So like a patient, for instance, like is having shoulder surgery. Before they go into surgery, kind of like a dentist when they numb up a tooth, I use ultrasonography, and I put numbing medication around the nerves that give them the sensation in their shoulder. So when they wake up from surgery, they have a totally numb shoulder and feel no pain. And we put a little tube there too, a little catheter as we call it, so that they can have that pain relief for at least 2 or 3 days after surgery.
I've actually heard that from people who had that done, that the first couple days are bad. It's after that
Right.
nerve blocks and that wears
Yes.
off.
Yeah.
So when you're working with patients and you said you're getting each case, the plan installed for them, a piece of that must be, we are nervous as patients coming in there and nervous that we're going to be put to sleep.
Yeah.
How do you deal with nervous patients, which most of us must be, to build that trust? I mean, obviously you're well educated and all that, but we're still nervous. You're going to put us to sleep for some time period.
Yeah. I think that's a great question. And that was one thing that drew me to anesthesia, was just treat them like a person, treat them like a human being, treat them with respect, be patient, listen to them, explain what you're going to do, and answer their questions. But first and foremost, just look them in the eyes, explain what you're doing, and just treat them like what they're having done. Don't just, it's not another day at the office. It's not just, I'm going to come and see you. This is what I'm going to do. You're going to be asleep. It's okay. But know that for many people, they've never had this before. I do it all the time. I see patients that are having surgery all the time. That's what I do. So for me, it's, yeah, I know you're going to do okay. You're going to do great. But that doesn't make it easier for them, because it's a first time experience for a lot of people. And sometimes people come in for things that are really serious, and you have to honor that and respect that, and just be there, be present, and listen to their concerns, answer them, and reassure them that they're going to be okay, that you're going to keep them safe. You're going to keep them asleep. I'm going to keep them asleep. I'm going to keep them safe. And if something happens, I'm going to do something about it. That's kind of what I say to them. I'm going to keep you asleep, but I'm going to keep you safe. And if something happens, I'm going to do something about it.
One of the questions that I have, Dr. Regas, is about coming out of anesthesia, because it seems like people talk about, I'll call them the war stories of coming out of anesthesia, that some people don't feel very well, or some people are going to just start talking like a blabbermouth all over the hospital. What actually happens?
Yeah, I think that's the number one concern. And I think it's like the number one concern of guys, that they're going to say something really stupid. They always say that. They're like, I'm so afraid. I'm like, and so, I mean, sometimes too, with the whole process, and when it's appropriate, I do like to incorporate humor. But I'm like, if you got something to say stupid, just say it now and get it off your chest. It's okay. You're in a safe zone here. But that's people's number one concern. And even today when I was at work, someone said that same thing. And I said, sometimes I wish it would happen more. It doesn't happen too often that people say things that are, terribly stupid or silly. But typically, the wake up process, it runs the whole gamut. I mean, some people can wake up pretty well from anesthesia. And the way it works is when surgery is done, anesthesia, most of the anesthetics for a general anesthetic is inhalational. It's breathed in through the breathing tube. It goes through the lungs into the bloodstream, up into the brain, and keeps you anesthetized. Okay. And so when the surgery is done, we shut the anesthetic gas off and we increase the oxygen that the patient's getting. So it flushes. We're flushing the anesthetic out, and it happens fairly fast. Usually within 10 minutes from us turning that off, the patients start to go into the wake up cycle. So, and once we know that the patient is in this wake up mode and is able to breathe on their own, then we take the breathing tube out. After that, certain people react differently to anesthetics, and we do give medications. Number one concerns is that the patient is not going to wake up nauseous. So we give medications so that hopefully they won't wake up nauseous. But some people are very prone to it, and to have their pain controlled. So those are the two big things that we want to make sure within those first few minutes to an hour or two after recovering from anesthesia that are covered, that they're not nauseous, not in pain, that their vitals, as in heart rate, blood pressure, oxygen, are all normal, and that they're doing well. So it's amazing how most people rebound pretty well. And for me in my profession, there's nothing more beautiful than when surgery's done and it's like you can tap them on the forehead, they open their eyes, you take the breathing tube, and they're like, I'm done? That's it? What happened? It's like magic. Even though I know the science behind it, to me, I don't know. It's such a great thing to see a patient do well and to have a successful procedure and to wake up and to be comfortable and ready to be on the road to recovery from whatever surgeries they've had.
So a question, and you hear this on the street all the time. Well, if I'm going to have surgery, I'm going to ask the doctor, am I the first? How often do you get that question from patients?
Oh, am I the first one that you've ever done this on?
Yeah.
You know what, Tom? Not as much that I've got this gray hair, but when I first started my practice, you get that look like, have you done this before? And I do get that, because I do a lot of those regional anesthesias, like, have you done this before? Or because we do a lot of labor, epidurals for laboring women. So you get that from some of the women, like, have you done this before? That's where I hear it the most. And I'm like, yes, I have.
Oh, I've done a dozen already this week. You're good.
Yeah, you'll be okay. I watched the YouTube video. We've got this all under control.
Yeah, I watched the YouTube video. Yes. I did stay at a Holiday Inn Express last night. I got a good night rest.
Yes.
Dr. Regas, you talked about doing some blocks and some shoulder surgeries. Is that one that you do every day, or are there some common ones you do on a regular basis, or is it kind of all over the gamut?
I do everything, but I do a lot of that. I do a lot of regional anesthesia. So I tend to do a lot of orthopedic, shoulders, knees, hips, but I do everything, pediatrics, but I tend to do a lot of the orthopedic stuff. So
okay, for people who are on medications, how does that come into play with anesthesia? And probably more as we age, and I can say that because I'm getting older, is more elderly people are on different medications, and how are the interactions with anesthesia versus different medications people are on, and how do you have to take that into consideration?
Yeah, that's probably one of the biggest things when we going back to talking about my day and assessing the patient is looking at the medications that they're on and how they may have an impact. There are some medications that patients have to be off of before they're under anesthesia, or actually more so having surgery, like blood thinners and things like that. And some patients are on blood pressure medications, so those can have an impact. So I have to pharmacology, the science of medicines is a big part of anesthesia, understanding what the different medications do to the body and how they may interact with anesthesia. So that's definitely something that we take into account, and the patients can't be on, and they're notified before surgery that these are medicines that you need to be off of for a few days prior to surgery. So it's a big part. And as we age, the list can be pretty long. And then the other factor is their allergies, understanding people come in with allergies and making sure that I'm aware of it, so that they don't get something that might interact with that.
Would that normally be an anaphylactic type situation, a breathing type situation, if it was an allergy?
Yep. Yeah, if they get some people have anaphylactic reactions to certain medications, and that could, if they get it, could be an anaphylactic type reaction. So
So you had mentioned that there's, through a breathing tube and we breathe in the anesthesia. Are there multiple different types of anesthesia that you would administer for patient A, B, and patient C just due to their chart? And each one might be on a different anesthesia, or is it generally the same anesthesia?
well, that's a great question. Most patients get this. Most patients get when they're having a general anesthetic, get the inhaled anesthetic. But there are quite a bunch of different ways to anesthetize a patient. And some patients that are fairly sick, we may do different type of anesthesia. Like say someone, for instance, wants to have their knee replaced. I'll do a spinal anesthetic.
Okay.
Injection of numb medication just to get them numb from the top of the belly down to their toes. And that's the anesthetic. They don't get the inhaled anesthetic, which can sometimes, for people who are really sick, have a bigger impact on them.
How about a surgery or a procedure where somebody's not going to be intubated, and they are going to be just have an IV and they're going to be put out? Is that normally for a shorter term surgery that you
Yeah,
wouldn't be intubated?
that's not necessarily like the length, but the amount of impact. So the way I look at anesthesia is aligning the patient's needs with the surgeon's needs, keeping the patient safe, comfortable, and then for the surgeon, creating an environment where he or she can do the surgery with the appropriate anesthetic. And like I tell my patients, anesthesia, there's general anesthesia where you're totally out with a breathing tube and I'm helping you breathe and you're not moving at all and you're not aware. To where you get a fishing hook in your finger and we put numbing medication and so they can take it out and you don't feel it. That's anesthesia. And then there's the in between, whereas you're having a colonoscopy. You don't need to be totally out, but you need something because you don't really want to feel some stuff. And that we do an IV anesthetic. So you're breathing on your own, but we give you a medication, primarily propofol, to get you sleepy so that you're in a state of anesthesia as if you're deeply sleeping at night. You're not totally out, just like say a thunderstorm rolls through and you might wake up in the morning and tell your husband or wife, did you hear some boomers last night? So you may have some kind of like vague, but but you're for all intents and purposes, you're asleep, comfortable, and unaware of what's going on down below.
Yeah.
So then the whole, like I said, then the whole regional anesthesia where when people get their knees replaced or whatever, I can numb up multiple areas of the body so that you don't feel anything and you could be awake. Really, when a person has their knee replaced, typically we do a spinal, so they're numb from the belly button down, but we normally give them that propofol medication so they're sleepy and comfortable because you know what, you don't want to be like, hey, what's going on, for 2 hours. But if you want to, you could, so
Okay.
that's always, there's a lot of, there are a lot of intricacies and differences. That's kind of going back, I guess, circling back, with anesthesia, like I said, the draw to it. I think a lot of it internally was that upbringing of the restaurant business. Whereas you got your recipes, you got your way of doing things, and you just kind of have to tailor it to, there's different ways to do it or different recipes, and you just kind of have to know which one goes best for that patient. And that's what that kind of drew me to it too, is just like in the business, like I feel like you've got a product that people want and need, and it's a good product and it's something and you gotta take care of the people, the customers, as my dad would say, and treat them with respect so that, they know that they're getting the best thing that they can possibly get in those different situations. And so that's, when I look at the patient's surgery and their needs and the surgeon's needs, I take all those into account to tailor the anesthetic to say, okay, what's going to be the minimum? Because you don't necessarily want to, like for a colonoscopy, you don't have to give them completely out, but, trying to find that balance and where the two things will meet for them to be comfortable and asleep.
I think most of us, if we're having our colonoscopies, would like to hear from you. Don't worry about it. You'll be completely out.
I know. Absolutely.
But we'll wake you up very quickly after.
I agree. I'll tell you in a couple months because I'm going to be having my first. So.
Oh, I promise you, it's not a big deal. I've been through it several times. The evening before is not as bad as everybody tells you it's going to be. It's all overblown. And
that's right.
You're going to be, and you know what? You're going to have a great anesthesiologist the day that you have those done. It'll probably be one of your partners.
I'll still be nervous though, just like my patients,
Rightfully so, but you'll know a lot more that's going on than we do.
Yeah.
So, Dr. Regas, for anyone who is listening to this and they're going, you know what, I always thought I wanted to be in the medical profession, and this sounds really interesting to potentially have a career path toward an anesthesiologist, what advice could you give to somebody and share, here's what I would recommend if that was the path you wanted to take?
Well, like I mentioned before, the first hurdle is medical school. If it's something, I think it is such a fulfilling career and the whole medical career in general, that if it's something inside of you that you really feel like it's something that you want to do it. Work hard, study hard, and do it. Because I think if you don't, you'll wish you had. And so do what you can to do it. Just say, all right, this is what I'm going to do. I'm going to take it as far as it goes, but I'm going to set my mind and get past that first hurdle, getting into medical school, and, just getting yourself out there, getting exposure to the medical field is very helpful. But most of all, just study hard, do your best. And if it's something that you want, just stick with it and do it.
Well, great advice. Folks, our guest today is Dr. Perry Regas, MD, anesthesiologist at Essentia Health. Now we're going to go a little bit personal. We won't talk about the colonoscopy coming up, but we want to learn a little bit more about you personally. First of all, I do know that you could have done this interview in not only English, but you could have also done it in Greek and Spanish.
I spared you. Yeah. I spared all your listeners the confusion and the subtitles, the voiceover that would have to occur.
Oh, that's pretty impressive. And I now understand where the Greek part came from the interview itself. So let's talk about a little bit of that. We call this, Dr. Regas, the packed questions segment. So we're just going to rapid fire a couple personal questions at you. Favorite place you've ever traveled to?
Argentina.
It's not Greece.
I know.
I would have bet my salary that you would have said Greece. Argentina. What was it about Argentina?
My mom grew up there.
Okay.
Yeah, that's that would be another podcast. But my mom grew up there. My cousins are there. I absolutely love it. It's a beautiful country. Buenos Aires is a beautiful city. I've been a lot of places, so I love, my wife and I love to travel. So it's a hard question, but I have to pay homage to my family in South America and say Argentina.
Oh, perfect. Who inspires you? Somebody that's at the top of their career. How do you get inspired?
Oh man, I don't know. When I think of inspiration, I'd have to say, there's three people that really inspire me. My mom, I know she's a huge inspiration for me. She's such a humble woman, but she is at the top of her game and doesn't realize it in everything that she does. in parenting, in just in living, in everything. She's definitely at the top of her game. My family is a big inspiration for me, and my sister. And then I did just a quick one. My wife is a huge inspiration. She's done amazing things in a short period of time. She ran her first marathon 2 years ago and qualified for Boston, and then ran Boston last year. So she set her mind to it, and was never really a competitive runner by any means. And to see the dedication of a person to say, I think I'm going to do this, and to do it in such a short period of time, I find that very inspirational. I'm inspired by a lot of people that I work with, but I would definitely have to say, those people really inspire me.
And I have to ask this one, Dr. Regas, what's your favorite Greek food that we all need to go try?
Well, I'm sure many of you have tried lots of Greek foods, but I would say spanakopita is my absolute all-time favorite, which I could eat every day, and my girls too.
And could you explain that to us?
It's spanakopita is, I guess, like the way we would describe a spinach pie. It's got spinach and feta cheese and dill and green onions, and it's layered in this crispy phyllo dough. This really, so it's got this nice crunch and this nice spinachy, cheesy center to it.
And have you learned how to make these?
I have, yes. And I'm still trying to perfect it. But I do like to cook quite a bit. And spanakopita is one of the things where I make often. And I try to find shortcuts to making it, because I used to just roll out the dough by hand. But I'm just like, okay, when you got two kids, I have a 7 and a 4-year-old, it's hard to spend time doing things that are too time consuming. So
sure.
Yeah. So,
well, Dr. Regas, we thank you so much for being here today. Our special guest has been Dr. Perry Regas, MD, anesthesiologist at Essentia Health in Duluth. And if you ever are being put to sleep for a surgery by Dr. Regas, you are in good hands, folks. You are in very good hands. Dr. Regas, thank you so much for taking your valuable time.
Thank you, Tom. This was really great. I really enjoyed it.
Folks, and until next time, unplug from the indoors and recharge in the outdoors.